Okay, so for treatment, we have lots of options here. Education is number one, which should always be on the list of things that you do. You should be explaining the theory behind whatever treatment you're going to use, treatment options, modifiable risk factors, and typical time course for recovery. But here it plays a particular role in the addition of exercise or gait training offers additional benefits. And you should touch on the fact of decreasing running speed, avoiding hills, and then splitting weekly distance or training load into more frequent but shorter sessions to make it more manageable. So that plays into the load management piece, is again following the guidelines that will come up in a following section in terms of continuing to be active but within a tolerable range. Therapeutic exercise is combined hip and knee exercises. And we mentioned that hip impairments are often a consequence of pain, but continuing to add some therapeutic exercise to that joint has shown better benefit than just knee extension exercises on their own. So you like to combine hip and knee exercises. Taping is an option. You can expect some short-term benefit here for roughly a month-ish, but that's going to vary wildly person to person. And then orthoses are an option over the counter for those with increased pronation, which is difficult to measure, but is an option. And you can expect some short to medium term benefits for that around 6-ish weeks. But ultimately, you want to have some combination of therapy here. So things you may consider are the gait retraining. The specifics of this are why it's in the maybe section. There is benefit to adding it, but what's most appropriate for the person is going to vary. So things like running softer, changing foot strike, cadence, we'll talk about those more in a later section. Blood flow restriction training, which is outside of the scope of this course to go through, but is something that you may consider if you have training in it. And then shoe change. So there's some evidence to suggest that maximalist footwear increases the patellofemoral joint loading by 20% per step and about 10% per mile compared with traditional shoes, whereas a minimalist shoe is going to be on the opposite end of that spectrum. So maybe playing with shoe changes or transitioning from maximalist to minimalist. But again, diving into the nitty-gritty of shoes is a little bit outside of this course. So things we don't recommend are sleeves or braces, IMS or dry needling. Manual therapy here is something not recommended. Whether that's lumbar knee, patellofemoral manipulation, mobilization, soft tissue mobilization, all of that is not recommended in this case. Here we have ultrasound again, laser, electrotherapy, and ice have all shown not to be useful in this condition.